Well, in terms of diagnosis and treatment of neuropathic pain, we have a long ways to go. Still, in our country, many patients have a component of neuropathic pain to their overall pain experience that is not recognized by those taking care of them. And then often when it is recognized, it's not treated adequately. And kind of beyond just the recognizing it, sometimes we need to really look for underlying causes and things we might be able to truly modify and think about disease-modifying things. And it can crop up in all kinds of unusual places, like the person who comes to see you for something else, but they mention that their feet burn at night, and you discover they have diabetes, and now you treat their diabetes, and that can be very health treating. It's very, very good for their overall health. But in terms of where we are with treating neuropathic pain, we don't have great agents, we don't use them very well, it's a challenge. I think that the treatment guidelines for neuropathic pain are helpful, and they're helpful because they tell you at least the treatments that have some evidence behind them. What they don't help do is help select which patient to give which drug to and in which order. And they also don't look at other things which we know are important to patients' quality of life and their overall experience, which are things like focusing on their sleep and regular exercise and diet and general health and their depression and anxiety, mental health situation. So they don't really look at treatments that may address those other things that may be not pharmacologic, or those other components, I should say, that aren't pharmacologic treatment. But for treating the pain part, the neuropathic pain part, if you're going to select a medication specifically for treating neuropathic pain, it makes sense, particularly for the first few things you try, to stick with things that are in the guidelines. So the French do it better because they have a lot of things that are better than we do. They have a shorter work week, which I think most people approve of, who live there anyway. They have better cheese and wine. But they also disseminated their neuropathic pain guidelines such that they got read by folks. And so when they present case vignettes to primary care providers in France, first the providers do a fantastic job of identifying neuropathic pain when it's there, like almost 90%, 87% of the time. And then once they identify that it is neuropathic pain, they select a first-line agent 90% of the time. We don't have good equivalent data in the United States, but we do have some pretty good suggestive evidence that that's not the case here. And that includes a study from Bob Dworkin looking at treatment of post-herpetic neuralgia in the community, showing that only 25% of patients got a first-line drug. Bunches of surveys of patients with neuropathic pain looking at the drugs that they actually take, and many of them are on medications that don't have any evidence of working for neuropathic pain. So we have a way to go to be more like the French. I think they're not well utilized, and they're also, I don't think they're placed where primary care physicians see them. I mean, if I was a primary care physician, I would never have seen the neuropathic pain special interest group treatment guidelines for neuropathic pain. Like never, I would not have stumbled across that. So I don't read Lancet Neurology. So I think we don't do a good job of talking beyond talking to ourselves in the pain world. We need to talk broader and make sure that these kind of data get presented in other venues where people are actually going to see it, which is one of the values of PAINWeek, actually, is that this kind of information comes to primary care providers and comes to those in the trenches actually taking care of patients.